Dear colleagues, my name is Mynzhylky Berdikhojayev. My assistant is Shay Ahmed. Operating nurse is Ayolum. Our doctor, guest doctor from Kyrgyzstan is Elaman, and our patient is 63 years old guy. And так, ну қайда тұр? Рахмет. Yes, and patient has multiple problems. The problem number one is, yes, you may notice patient after coronary bypass. Couldn't see. Так, сигарет емес не нашасаш? Ayol. Exact. 9:30 или 10:30 exact var mı? Yes, I'm asking for exact stent. This patient previously operated. Yeah, sure. Was previously operated on the right side. It was chronic occlusion. Қашан жасадық операция? 3 months ago, we did a revascularization with the stenting of intracranial ICA and the extracranial ICA, and today on control angio, on control angio, ICA is again occluded. Patient has good PCOM on the right side, and also at the same session we placed stent, credo stent in left vertebral artery V4 segment. It was subocclusion, and today the artery is fully patent. And patient has a diabetes and quite aggressive atherosclerosis. And during this short period of time, artery is occluded. Now there is a dilemma. I think we need to I think we need to do perfusion imaging for the ICA territory, and if there is a deficit, perfusion deficit, then we will. После? Қашан болды?
TIA где-то полгода назад.
Yes, patient had TIA on the right side, and that's why we did the revascularization. But not all revascularizations are patent, and yes, the left vertebral territory is okay. That's why the patient was planned for stenosis on the left side, for the intracranial stenosis stenting. And on control angiography today, the artery looks stable. It's 2.3 millimeter. 2.3 millimeter remaining diameter of the artery. That's why we are planning to place, okay, it's extracranial, and this is intracranial. Per second. Yes, and Shehmet and Murat just arrived from Arizona. Yeah. What's the name of the hospital in Arizona?
St. Joseph Hospital.
St. Joseph Hospital, yes. And they really enjoyed the stay in Barrow Institute. This guy, he's Shehmet. Yes.
It's me.
Yes. And now we have a patient with stenosis and also with intracranial stenosis, but the measurement is 2.3, and this artery is taking care for both hemispheres, and there is a marker of the stent on the contralateral side. It was aclinoflex, and also we have in basilar and vertebral artery, in vertebral artery and the right ICA territory. So, назад. Smart mask. Now plan is to place protection device in left ICA because of irregular atherosclerotic plaque. We are using 7mm Pronder from Lepo Medical. It's a good copy of Spider filter from Medtronic. We will place directly the stent, and we'll see the remaining diameter. If it will be okay, then we'll leave it like this, and stent is 10 by 30. It may open the stenosis, and if not, we can inflate one balloon. As for intracranial stenosis, I'm not sure we need to do anything else, but I need to know the opinion of Sheikh Ahmed. What do you think, Sheikh Ahmed? Do we need to stent intracranial segment? It's a 2.3 and distally 3.8.
So we have guidelines.
Yes, he's from United States, and he's saying guidelines. Yeah.
They recommend only anyway patient will go.
Yes, the
for
guidelines
medical
is
therapy.
dictated by the medical insurance companies. Yes, and but we have a difference in healthcare system. I could not rely on the emergency service, and not everywhere available endovascular techniques for the emergency patients. That's why I'm not sure it's correct to say guidelines. If you say guidelines, guidelines should be in all healthcare system. Do you agree with me? If you try to say guidelines, then all systems should work with guidelines. Tutacağım canım.
Maybe it makes sense.
It makes sense, yeah. In the flatter perisal. Yes, we will do angioplasty, and then we will see about the intracranial segment. Yes, the right side was credo, and maybe we'll place 3mm aclino intracranial ölçüyoruz.
Ölçemem mi?
Kim var anda? Kızlar baldır. Yes, the anatomy is not so complex. It's possible to place coronary stent there, and coronary stents are better. Так, in the flat. No, in the flat. Диаметрін өлшеп жүрші, последний ангиография бойынша. Стеноздан кейін, стеноздың деңгейінде, интракраниально. Yeah. I'm asking Maksat to measure the stenosis severity in intracranial segment. Yes, and at the end of October, in November, December, most part of the hospitals could not provide endovascular treatment because of the finishing of the budget of governmental insurance. That's why in some cases maybe it's better to stand. Ұзындығын өлшесе аласыз стеноздың? Стеноздың ұзындығы. Ага, орай. Öyle versin. 20.
10, 12, 14, 16, 18, 20.
Okay, Nazım. Yes, I asked Shahmet to give 20 atmospheres. Yes, I especially pulled the balloon because of only the artery, but there is a good picom. Ұзындығын өлшесе аласыз стеноздың? Стеноздың ұзындығын. Yes, we have no control panel, and also the mouse was attached to the control panel. That's why it's impossible to work with mouse in this condition. Okay. Точно. Қанша? 11. 3-те 12 деген стенд ашып бересіңізші? Айыл. Now I will retrieve protection device. Жо, 3-те 12 коронарный, ногами. Вон вақтасы. Так, абайлы. Хорошо. Темірге текіп берсін. Сөйтіп гайдлайнмен жұмыс істеймін. I'm just joking, yes. It's better to work with clinical recommendation and guidelines. Not only doctors, also the healthcare system should work in international standards.
No, испанец, помните, Роджер?
Баранко?
Роджер Баранко. Он, работая в странах Ближнего Востока, он выявил, что, оказывается, у этих людей, у арабов, часто встречается инсульт, протекает как субакют. И они продолжаются длительное время.
Yes, we are talking of the experience of Roger Barranco. Roger, I hope you are hearing us. And yes, Shahmet is...
There's a lot of intracranial stenosis, a lot of
yes,
basilar stenosis, mostly posterior circulation is like suboccluded, sometimes occluded.
Yes, this population is different than the population used to live in guidelines. Yeah?
Yes.
Okay. And also the platelet inhibition reactivity of the medication we are using is less. It's more than 25% of in the flat. More than 25% of non-active medication takers назад, пока лимитер. And yeah, it's quite interesting.
And he says that in Kazakhstan
Yes,
there's
in
no
all
information.
in all protocols, they say clopidogrel is a gold standard, blah blah blah. Okay. Сейчас. Yes, clopidogrel is gold standard in European countries, but not in. Медленно. Так.
Екі, төрт, үш, төрт, бес,
Алты бересің.
алты.
Алты. Сегіз. Медленно.
Сегіз.
Все, держи. Yes, the cardiology experience need to leave little bit balloon inflated because the stent should open with time. Назад. It's from cardiology colleagues. Huh? Yes, it's a stenosis, and the most effective instruments in stenosis is cardiology instruments. Means VMM сзади. Все. Okay. Let's inflate the stent till the nominal. I will little bit pull the balloon. Тогда омбр берет. Омбр. We'll give 11 atmosphere. It's a nominal pressure for this stent. Напряжение норма?
Средний.
Чуть-чуть еще.
Уник.
It's a 12 atmosphere for 3 mm stent. Ну-ка, берешь, он только один, медленно.
Вообще напряжение.
Вообще назад. Yes, we gave 14 atmosphere for 3 mm stent. And this stent could be opened till 4.5 mm. It's a 3 mm stent. Oh, now it's better. Yes, the proximal ICA also stenotic, but on lateral view there is no stenosis. Huh? Yes, we covered the stenotic segment with stent. It's possible to inflate till... Ну-ка, вперед, 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 вперед. Yes, I think we should stop at this point. It's not cosmetology. 3.1 millimeter, the new diameter. 3.1, yes, and the previous diameter was 2.3. It's nearly 1 millimeter more. It's supplying both hemispheres. That's why it's better to have the artery like this. Okay, lateral. Yes, we can see the cervical artery, ICA, and intracranial. Yes, the both stenosis is... without perfusion, I can say this patient needed bypass because the cortical collaterals are covering the MCA territory. It's better to place the bypass in 3 months.
In 3 months?
Yes.
After finishing...
After finishing the Berlinta in 3 months, then we will switch for aspirin and do the bypass on the right side. Okay, thank you. Just a second. I think I forgot to show the other territories. This is the occluded ICA. The PCOM. PCOM is not so good. Yes, the patient needs bypass. It's also possible to do decanalization again, but I'm not sure it's necessary. We did once, and now 2.3, 3.6. Because of 3 territory, we did this maneuver. We placed stent in intracranial stenosis, in extracranial stenosis to stabilize the plaque on the neck. Yes, with guidelines in European countries, you don't need to treat this patient. And in V4 segment, there is also stent in place. And we placed protection device, and then we placed the stent in intracranial territory. The microwire was Xeon regular. There is a Xeon, Xeon blue, Xeon black, and now we use Xeon regular with stent Ultimaster Nagomi 312. Okay, the stent at the neck was exact from Abbott, and protection device was Prondor. Okay, now Sheikh Ahmed will do expert CT, and then we will finish and see you in 25-30 minutes. Next patient is callosal AVM. Next patient with callosal AVM, not is. Okay, thank you. Все, можно. Dear colleagues, the CT is ready. Yes, now you can see the whole CT images. Thank you for Roman, and he did it possible. And you can see the right lateral ventricle is a little bit larger than left. It could be sign of chronic ischemia. There is no big ischemic lesion. Yes, this is a stent in vertebral artery, and the rest is okay. Okay, let's finish this case. See you in 25 minutes.